research lab opened in Victoria today. It is the most advanced facility for T-cell therapy development in the country. That's when doctors remove immune cells from patients, engineer them to target a specific cancer, then put the cells back in the body. Cancer researchers have already claimed huge success in early clinical trials. Monica Martinez explains.
The opening of the Conconi family immunotherapy lab marks a new approach to cancer treatment, running clinical trials that will be the first research of its kind in the world.
This is extremely innovative. There's just a couple dozen centers in the entire world that are set up with this sort of infrastructure to do T-cell therapy.
Immunotherapy uses the body's natural defenses to fight the cancer. Doctors recover T-cells, a type of white blood cell, after surgery, and then isolate and purify them in these sterile units.
So we can grow them up to billions of these T-cells. We might start with 1 million or so, and we'll end up with billions of these T-cells that we can then send back to the patient for infusion via an IV infusion.
Trials will be open to ovarian and cervical cancer patients who have not had success with the current standard of care.
I can tell you that in most models that we work with, we don't use chemotherapy or radiation therapy. We're able to actually give curative treatments to mice using nothing but T-cells alone.
The Conconi family donated $2 million to the $5.5 million lab. Bob Conconi remembers when his father was diagnosed with skin cancer in 1978. He passed away 9 months later.
When we asked the doctors, there was really no known cure. All they could do was prolong life at that time.
30 years later, he got the same diagnosis, but thanks to advances in treatments, his result was much different.
And within 6 weeks of the biopsy, I was in treatment, and the treatment lasted for about 7 weeks. And I'm now 5 years cancer-free.
Doctors say immunotherapy offers exciting possibilities that has the potential to revolutionize cancer care. Researchers say they'll be approaching the Ministry of Health about funding future treatments. Phase 1 of the clinical trials are set to begin in early 2017.
Coming up, Ottawa announced